and welcome to another episode of Nappy Changing and Brand Building with me, Laura Crawford, CEO and founder of Mama Bamboo. And today I am delighted to be joined by Dr. Daniel Gordon. He's a private GP in a North London practice that specialises in pre and postnatal care and paediatric care. Their service offers you telephone or face-to-face same-day appointments for any of your concerns and anxieties. And in particular, they offer a holistic approach to diagnosis and therefore a better treatment plan. So, Dr. Daniel, it is fabulous to have you on the show. Welcome, Gordon.
Thank you. And thank you for the kind introduction.
Am I okay to call you Dr. Daniel, Dr. Gordon, or Daniel?
Daniel, please.
Perfect. Okay. So to start with, if you could just tell me a little bit about how you got into private practice and how it differs from the service that's available on the NHS with the health visitors and the standard GP.
So as with most things in our careers, it happened by accident. I had an opportunity to work in a private clinic. And I think my views about private care were a little bit warped at the time, and maybe it was more financial. And when I started working in private care, I realized that what it really does for you as a doctor, and the reason that we're doctors is, most of us enjoy what we do. It allows you to practice in a much more free way. You get more time with your patients. You get to work with your patients without some of the restrictions of being in the public healthcare system. And I'm sure we'll touch more on that in later parts of the discussion. But the more that I did that, the more I realized that it was kind of the way I saw myself being a doctor right at the very beginning. I think the way many doctors see themselves working. And so the more you do it, the more interesting it becomes, the more opportunities develop, and my list grew. And accidentally, over time, I ended up being a solely private GP.
That's lovely, actually, because I think a lot of people have that vision of the old-fashioned GP being a proper family doctor, someone that you, your husband, your children, your grandma all go and see the same person. And I can see the benefits from your side of getting to know a patient and a family. What are the key benefits for the individuals that come to you?
You've hit the nail right on the head there. So I am like the old school GP, and I think that's what I was looking for in medicine. So, I see, parents will bring their newborn babies to me for their 6-week check, then for their 8-week vaccinations. And then if they get a fever or cold, they'll come back to see me. And so I'm often the doctor that sees this child the whole way through. I've got children who are, 6, 7 years old now, who I saw right when I started private medicine, who still see me. And who I've kind of watched grow. And look, the benefits are for the parents specifically is I think they develop confidence in the relationship. It's often people get quite surprised when I say that I don't really have many fights about antibiotics, because when parents know you and trust you over time, they're much happier to accept your advice, I think. And it's kind of understandable that if you don't know a doctor, you might question it. But actually, when you've got a relationship, it's much easier. And I think the other thing which I've noticed is that the children, because they know you, going to the doctor is something they enjoy. It becomes, we have a thing in our surgery where children are allowed to draw pictures, which we put up on the walls. So we have a little wall of art from the kids, and we have toys. And so it's an experience, and it's an experience, and it's not a negative experience for the child.
Yeah, it's not in the least bit scary, and you're going to see a familiar face. And yes, exactly. I can see that the parents would come to trust the advice because you would know that child inside out, and be able to actually view them over a longer period of time. As you say, the NHS is often a very short appointment and can only treat the immediate issue that has come to them. They don't have time to build that holistic picture.
Yeah, I would say it's an ongoing conversation, and that's the way I see it. So, you might see the child for a cough or cold, and you can quickly say, kind of, oh, how's the constipation that you remember like 3 months ago I gave you a prescription? How's that going? It's kind of more of an ongoing conversation.
You must get this a lot, Daniel, but we asked our clients to send in their questions, and unsurprisingly, there are lots of questions that new mums and dads have, particularly around baby care and newborn care. So if you don't mind, we're going to quiz you mercilessly now for the next 15 minutes.
No problem.
So the first one actually is about colic. Now, we do get this a lot with new mums and dads being told that their baby is colicky, and being prescribed colic relief medicines. My understanding is that colic is actually a symptom rather than a diagnosis, but maybe you can explain it a little more to us.
Yes, I think that's a really good question. Funnily enough, when thinking about this, I can't actually think that of the last time I gave the name colic to a parent or diagnosed colic. It's just not something I've really done that much. I think to start off, we have to understand that the spectrum of behaviour in babies in terms of their bowels and irritability is really, really wide. And the normal spectrum is really, really wide. And at the end of the normal spectrum, we obviously have a small range of abnormal things, such as blood in the stools, failure to gain weight or losing weight, persistent vomiting. But because the normal spectrum is so wide, it can be very difficult, I think, for parents to differentiate or even accept a baby who may be more irritable and exhibit behaviours which can seem like distress, like screaming after feeding, back arching after feeding. And so I think that's where the colic term comes in. I think it's partly it's an acceptance that we don't really know why babies go through that time period. And I often will say to parents, they're just not familiar with the sensations in their body. For us, we know when our tummy gurgles or we get a slight cramp, it will go away. We don't even factor that in. But for them, every sensation is new. And so they react by crying, which is the only way they can communicate. So the reason that I think we do recommend colic medications is because from a risk-benefit basis, there's no real risk with them at all. So they're pretty safe. So and I think the reason many doctors do recommend them is because we want to do something to help when we know that it's likely that really time is what's going to help the most.
Yeah, that makes sense. There is very little risk to taking colic medicines, and if it eases your baby's discomfort a little bit, then it's worth doing.
And I always say to parents, I'm really open-minded. So as long as it's something that's mainstream, known to be safe in babies, I don't discourage, and I don't say, oh, that won't work. I say, I often will say, look, parents that I know have had mixed experiences with this, but I'm very happy for you to give it a go.
Fair enough. That makes sense. Another one that came up an awful lot with our ladies was around breastfeeding, and in particular, those that want to breastfeed and stick with it, but it's hurting. We had quite a few say they think their latch is okay, but their breasts are hurting whilst breastfeeding. Is there anything they can do to relieve it because they want to continue?
Yes, yeah, that's a great question, and in a way, it would be, I think it's quite interesting to go back to personal experience, obviously not myself, but my wife, and we had our kids. There was a lot of the pre-education on breastfeeding emphasized, if you're doing it right, it won't hurt. And we certainly found as a family that my wife, that wasn't the case. And I see a lot of mums on a regular basis in whom it does hurt. So I think that accepting a degree of normality, however, it shouldn't hurt as you get better and as things progress. So I think, the pain in the first few weeks, as you start to suffer with kind of cracked or sore nipples and so on, that is to some degree normal, and we have to try and manage through that. But I think after you've been doing it for some months, that shouldn't be the case. I would often recommend seeing a professional, like a breastfeeding consultant, if you're struggling, because you may think your latch is okay, it may not be perfect. There may be things you can do to optimize the situation. And I think the secondary part would be, it depends where the pain is. If it's a pain around the nipple, I would see a GP. You may have thrush on the nipple. Again, cracked or sore nipples, there are things that can be prescribed. If the pain is in the breast itself, it may be a supply outstripping demand issue, in which case there are things you can do to reduce supply, such as using cool compresses, make sure that you're not pumping in excess, because that will always stimulate supply. For mothers that are really, really struggling, actually we can prescribe medications to reduce breast milk supply, but we only do that in very specific situations.
Okay, that makes sense. And I suppose the one to always watch out for is if actually your breasts feel hot and you have a slight temperature, that would indicate possibly you actually have
Mastitis.
developed mastitis, and do
Yes,
need to get yourself to the GP.
absolutely.
Yeah, always being aware is that one extra step. Personally, I breastfed both of my children for 2 years each, and certainly being told it's natural and it's lovely and it's beautiful, it didn't negate the fact that that first kind of 6 to 8 weeks, it was difficult, and it was quite painful. And sometimes, yeah, certainly when you were really full and that first let down, ooh, there was a moment of pain there.
Yeah, and I agree on the time frame. You say 6 to 8 weeks. I think after 6 to 8 weeks, generally, if you're breastfeeding regularly, it shouldn't be an ongoing painful experience at every feed. So that's the time when I would definitely be seeking some professional help.
Yeah, and I will say from personal experience, which is all I can talk to, it eased out and it became a very comfortable, natural thing and very convenient to do, which is why I kept it up for so long. Brilliant. Okay. Another one that's also close to my heart. Seriously, I think my baby's had every problem going. Constipation. My baby is struggling with constipation. The doctor doesn't seem willing to prescribe anything. I've been keeping a diary. She's hardly eating. What are my next steps?
The first question I'll ask any parent with a baby who they describe as having constipation is what they mean by constipation. Because there are two things that often parents mean. One is hard, like rock hard stools, or straining at stools. The other is not opening their bowels very frequently. And it's actually quite common to see parents with babies who are just not opening their bowels very frequently, but who actually aren't constipated. A breastfed baby can go 7 days without opening their bowels, and that is considered at the
Normal.
limit of normal, but it is within the limit of normal, providing there are no other worrying symptoms such as hard stools and so on. However, if there's hard stools, difficulty opening bowels, straining, blood in the nappy, or as this parent may be alluding to, it's affecting them in other ways, such as reducing their appetite, then it may be constipation, true constipation. And there are things you can do in terms of, and again, it depends on the age of the baby and whether you've weaned and whether there's something you can do with the diet and water intake. But again, that depends on the age of the baby. But generally, I would actually usually recommend, or I would prescribe medicine quite early for a baby who is truly constipated with complications such as reduced appetite, because some babies just need a little bit of help to take them through that time period.
Yeah, and I think from my experience, getting in there early-ish is really important. My daughter actually learned not to eat because she knew it was going to make her tummy hurt and she would be constipated. So it became quite a vicious cycle. By the time she was
Exactly
9, 10 months old, she'd already learned not to eat, which was, yeah, a
exactly.
very
And
difficult
also
time.
children when they're constipated, when they have hard stools, they can get little tears around the back passage, which means when they do poo, it's really painful. So then they don't poo, which makes them more constipated. So the reason that I jump, if I'm confident that a baby or child is truly constipated, the reason I would jump in as personally quite quickly with some medicines, some laxatives, is that you want to break the cycle quickly for the child.
Yeah, absolutely. And I think I'm just going to call out a point here. So as you were answering that question, you're saying it depends on the age of the baby, it depends on the type of stool that they're doing, it depends on their diet, lots of mums and dads these days take to Facebook to get their questions answered. And my kind of take on this is you need to know the child and the situation to give any form of medical advice. So possibly Facebook isn't the best place to be asking, because you will get an entire spectrum of advice on Facebook without anybody ever meeting your child or knowing your child.
It's so difficult because on the one hand, I mean, I agree. On the one hand, it's empowering having social media, and I think for new parents, it could be an amazing source of information. But once again, you can see how quickly you might get misinformed, not with any intent, but if your baby is breastfed and hasn't opened their bowels in 5 days, but is absolutely fine, and you put a post saying my baby's constipated on Facebook because that's what you think is going on, then you will get lots of replies about how to deal with constipation in babies, and it can quickly feed a cycle where you're getting the wrong information. So I completely agree. I mean, as an experienced doctor, I never ever give information out over social media, specific information out like that.
Yeah, I think you need that sort of credible source and someone that has experience and been able to see your child, or at least speak to you
Exactly.
in person.
Exactly.
Brilliant. Okay. Another one that we hear a lot about. My baby has reflux and is clearly in pain after feeding. What can I do to help them? I've heard many myths from my mother, which I'm not going to follow up on. So what should I actually be doing?
It's useful to relate the reflux question back to the colic question and say that there is a huge spectrum of normal, and then there's a little bit of abnormal at the end, which is the ones that we really do need to know about. Reflux is where the passage, you get passage of milk and acidic contents from the stomach up the food pipe. And it's important to say that every baby has reflux, because the top of the stomach, the bit which keeps food from going up after eating, hasn't fully developed yet. And that comes with time. That comes with sitting up, the baby being able to sit, because gravity then helps keep everything down, and with weaning as well. When there's harder food in the stomach, there's less reflux. In terms of what they can do, so I think, again, if they've got serious concerns, then professional support is always really important, because there are babies with severe reflux who may have things like cow's milk protein allergy. Yeah. They may be losing weight. There are some what I would call conservative measures that you can do. So you can switch to a over-the-counter reflux reducing milk, or you can look at cot positioning, so putting the bed up at a slight angle. And then, of course, there's the slightly more intensive things that you can do. As if you see a doctor, we sometimes would prescribe anti-reflux medicines for the baby.
Yeah, absolutely. And I think just a point on the cot. If you're going to tilt your cot up slightly, make sure baby's feet are at the bottom and the blanket is at the right level. If you put them at the top and you elevate the cot, the baby can wriggle down and go under the blanket. So just make sure their feet are at the bottom if you're going to tilt your cot.
Yes. And yes, and there's been lots of safety warnings about all the different special pillows and things that you can buy for reflux. One of the easiest things that you can do is simply put some books under the end of one of the ends of the cot. Then you're not putting any additional cushioning or potential suffocation material in the cot. You just tilt the cot by putting some books under one end, and exactly as you said, make sure that the baby is right at the bottom at the start, that they can't slide down under their covers.
Perfect. Good advice. A good one here. I expect in the first year my baby will have several colds and temperatures, but I don't want to call the doctor every time. But when should I be concerned about a temperature, or that my baby's not feeding or drinking?
That's a really difficult question to answer, because it is case by case. And I would actually encourage parents to visit the NHS website for this, because there is what doctors would call a traffic light system, where it breaks down different age, different child, and tells you when you should worry. So, for example, a baby under 3 months, a temperature of over 37.8 always has to be taken extremely seriously, and normally they need to be seen in a hospital. Once they pass 3 months, it's normally over 38, but they don't have to necessarily be seen in hospital. It depends on lots of different factors. I think what I often say to parents of children over the age of kind of 6 months to 1 year is, it's not always the height of the temperature that necessarily dictates how worried we are as doctors. It's also the way that the child is behaving, their oral intake, whether they're feeding or not, their urine output, whether they've got a rash. So there are so many factors that make up the answer to that question. And there are some really good resources online that I would encourage people to check out.
That's brilliant, actually. I think it's lots of parents feel like they shouldn't call the doctor, but like you say, there's lots of information online that they'll be able to get access to. And as you say, look at the child as a whole, not just the temperature. Good. Okay. An interesting one here. My son has just started weaning. and we've identified possible allergies, egg and dairy. I think allergies seem to be on the rise, don't they? The egg reaction was very strong. I'm scared to keep trying new foods. Is there a better way to test him?
What a great question. So there are two types of allergy queries we get. I think some which might be a bit more dubious around intolerance to certain fruits or questionable symptoms around, behavior after eating. Funnily enough, egg and dairy are really common allergens in children. And actually, it sounds like this parent probably has observed an allergic reaction in their child. What they would need to do next, so it's very important to seek help really quickly for that. The reason isn't necessarily because their child's at risk of an anaphylactic reaction, but it's because actually appropriate testing, which includes things like skin prick tests or blood tests, needs to be done. And they also need to test for other coexisting allergies, because often allergies come in a pack and you kind of have a few that live together. The other thing is that I see quite a few parents who try and self-exclude ingredients like egg and milk, and it's actually incredibly difficult to do that because, for example, milk and milk powder and milk protein is present in a huge amount of processed foods that we eat on a daily basis, like ready meals, cakes, biscuits. So, for example, in our clinic, if we diagnose a child with a potential milk allergy, we always make an appointment for them to see our dietitian, who will take the parents through a full dietary history and really help them to ensure they are excluding the appropriate food groups. So I think if you believe and you think you have seen an allergic reaction in your child, you do have to seek professional help. Go to your GP, get a referral to an allergy clinic for a proper assessment and proper advice on whether you need to exclude or not. And the other thing to add in there is that what we don't want to do with our children is to unnecessarily exclude important food groups.
Yeah, absolutely. You don't want to cut them all out if it's not necessary.
Exactly.
That makes sense. Are we finding that allergies are on the rise, or is it just that we've got better at diagnosing them these days?
I think it's both, to be honest. Allergies are definitely on the rise, and there's a whole range of different scientific hypotheses for the reasons, but certainly peanut allergies, hay fever, milk allergy, egg allergy, they are all on the rise. The good news is for children is that many food allergies, they do grow out of completely. So milk allergy, the vast majority of children will grow out of it completely, but there are some that can linger into later life, into teenage years, and into even adult life, which is why they need professional follow-up over time.
That makes sense. Okay. Okay, another one here. How can I help my daughter with her eczema? So moving on to skin now. Her skin looks so sore sometimes, and I don't know what to do.
Okay, so eczema is extremely common in children. You tend to get these dry patches of red skin. Often it affects the inner arms, the back of the knees, the head, neck, face. A lot of parents come in worried about allergy and whether there's a food allergy that's driving it. And in many cases there isn't. But in a child where there's really severe disseminated eczema all over the body, especially one that's not responding well to treatment, then I would usually consider whether there may be an allergic driver to that eczema. But otherwise, there are two mainstays of treatment for eczema. The first one is moisturizer. And you need to be using a thick, greasy moisturizer on a regular basis. And by regular, I normally mean 3 or 4 times a day. And many parents kind of gasp when I say that.
A lot.
Is what keeps the integrity of the skin. It's a lot. And also, you should probably be using a moisturizer, an appropriate moisturizer as a soap substitute in the bath as well. And then the other treatment is topical steroids. So steroid creams that you rub onto the worst patches to help them calm down and reduce the risk of them getting infected as well. A lot of parents get worried about topical steroids because the word steroid, I think, conjures up lots of images of kind of negative images. Yeah. But the truth is, topical steroids, when used appropriately and as prescribed, are not absorbed in huge amounts into the bloodstream and tend to have very, very few side effects, and they work exceptionally well. So we would use steroids for short cycles, 2 to 4 weeks, to just break the worst of the flare of eczema. But then the mainstay of the treatment is the moisturizer.
That makes sense. And actually, the 3 to 4 times, although it sounds a lot to start with, if you think of how many times you're changing your baby's nappy in a day, if you just built in that you also add the cream on at the same time, it'll
Exactly.
become like a second habit.
That's exactly what I say with each nappy change. And I'm pragmatic as well. So for school age children, I say for young primary school age children who aren't going to do it themselves, I say do it just before school, as soon as they get home and before bed. And at least you've got 3 applications in.
Yeah, that makes sense. Build it into your day, and then it'll be more normal and
Exactly.
a habit for you. Perfect.
Exactly.
A really interesting one that came to us. My daughter's 12 months old and shows little signs of communicating with me. She doesn't wave or smile, and she doesn't try to talk. They've checked her hearing. She's okay. Mum thinks she could be autistic. Would this show up this early?
This is a difficult question to answer, not specifically. And again, I need to reiterate, I don't know this child, I don't know the situation. But I think that is a worrying question. Because I think as a GP, and again, I don't want to cause undue concern to the mother, but what you're talking about here is potential neurodevelopmental symptoms. That doesn't necessarily mean that there's a problem, but the mum is concerned that the child isn't exhibiting appropriate behaviour, social behaviour. Now, autism and autistic spectrum disorders are they're disorders of primarily of social communication, social interaction and communication, but there are many other neurodevelopmental conditions that can cause similar or different symptoms. And the other thing about autism and autistic spectrum disorders is generally they're quite hard to diagnose before the age of 2, and the usual age of diagnosis is around age 4 to 5. So I think that this mother, and any parent who has a child in whom they think that their social behavior and interaction is not where they expect it to be, then definitely don't do Facebooking, and as we've already discussed, then you should see your GP, because they will be able to do a developmental check on the baby and discuss their concerns, and they can refer on to a developmental pediatrician as well. And a developmental pediatrician can look at loads of different reasons why the child might not be behaving, and whether there is actually a concern, or lots of different reasons why there may not be. And often what will happen is that those developmental pediatricians will keep looking at this child over time. So if there is an autistic spectrum disorder or something, then it might come out over time, but these things do take a little bit of time to diagnose. Is that a clear answer?
Yeah, and I think this comes back to our earlier discussion about why kind of a family GP that's looking at your child holistically is a good idea, because any of these kind of things will take time to diagnose, and somebody that is involved with you and your child over a longer period of time will be better placed to help you make that diagnosis, certainly than kind of Googling symptoms and or Facebook, which I think would be quite dangerous in this case. I remember getting those milestone checks, your 6 months, your 12 months, and kind of running down the list myself and going, oh no, she doesn't do that, and she can't do that, and she definitely hasn't had a go at that. And doing the comparing thing that all parents do, the kid down the street can already run and mine's still lying on the rug. It doesn't necessarily mean there's a longer term problem. They all develop at slightly different, they're on their own path, aren't they?
Yeah.
Okay. Right. The last question I've got actually is coming to mum, and probably one that we all feel at different times, but I'm really struggling. I was so excited about being a mum, but this is awful. I've felt this way for weeks now, and I can't sleep. I'm tired, and he cries. What am I doing wrong, and how can I get better at this? I will say, I think all mums suffer baby blues at different times, and all mums have that moment of, oh God, I've given up my lovely life, and now I'm at home with a screaming baby, and this isn't this is not the picture perfect that I was looking for. But when is that worse than just, this was just not quite what I signed up for?
That's a great question, and I'm happy this has been asked because it's really important to bring awareness to it. The part where she said, "What am I doing wrong?" Again, I don't know this mother and the baby, but my gut feeling would probably nothing. There is a slight Hollywood and social media lean nowadays to what is normal and the kind of filtered experience of having a new baby, and behind closed doors, having seen hundreds of parents go through the process and having been through it 3 times with our 3 children, I can tell you it's an incredibly hard life transition, and I don't think people are prepared enough for that. And those first few weeks and months are really, really challenging. What I would say is, I say to most parents is time does really help. And I say, really the first 6 months until your baby is interacting with you in a predictable way. But if you're struggling, and the way there are a few symptoms I'd be particularly worried about. So if you've lost the enjoyment of life, so if life just seems really grey, if you're sleeping really, really poorly, and that's without baby crying and waking you up, if you're feeling tearful a lot of the time, if it's like you just feel like you're under a grey cloud, if your appetite has gone down or you're not eating, or vice versa, if you're overeating, then those can all be symptoms of postnatal depression. And the gap between baby blues and postnatal depression, it can be narrow. And not even baby blues, but the gap between, I think, exhausted new parenthood and postnatal depression can be very narrow. And it can be difficult, I think, as a parent, because you're so in it at the time, to really be able to step back and say, actually, I'm really struggling. So I would speak to a professional. GP is a really, really good first port of call. I will always give a huge amount of time to a new mum or a new parent who is struggling. You can also engage with a counsellor if you feel that's what you need. You can speak to a friend honestly and openly. There is loads of things you could do, but I think you have to share at that point.
Yeah, I think that's really good. Just start talking to someone.
Exactly.
Start with a friend if you feel capable, but a GP, a professional, can help you. And that there is an awful lot that can be done, and a lot more recognition of postnatal depression.
Absolutely.
Super. Well, I've come to the end of our questions. Don't worry, we didn't ping you all of them. We tried to group them up for you because obviously there were many. I think most new mums and dads have an awful lot of concerns and a lot of questions. Again, for anybody that is interested, Dr. Daniel Gordon's practice is online. There are other private practices as well across the nation. Obviously, Dr. Daniel works out of the North London practice. But if it is something that appeals to you, do have a look. I personally think it's a great idea to have what I would call an old-fashioned family doctor who really does get to know you and your children, and treats you more holistically, and gives you a better service. So thank you so much for joining us, Daniel. It was absolutely lovely to talk to you and ask all our questions.
Thank you for having me.
Pleasure.